conference will now be recorded.
Okay, so welcome everybody to our AnCan VSI special event, which today precedes our regular support group that'll start in about an hour and a quarter. And this meeting is being recorded as an educational event and not a support group. And we are thrilled to welcome a VSS peer, a psychoanalyst in her own right, Dr. Paula Hechinger, who is joining us from Portugal, where it's around, I think, 5:30 in the afternoon, 5:45 in the afternoon. And I suspect we've got people from other parts of the world. I know we have somebody from Holland with us right now, from the Netherlands right now, and I suspect there could be people from other places too. And Paula's going to talk to us a little bit today. I should have said I'm Rick Davis. I'm sorry. I am Rick Davis. I'm still Rick Davis. I am a VSS peer. As most of you know, I figured out through joining the groups, because I never realized I had VSS, although I've been living with it as long as I can remember. So Paula's going to talk to us about her experiences and how she manages and how she can help you manage. And Paula is a moderator, although she's been pretty busy. And so she will be helping us moderate this session, and maybe when she returns to the United States, the session that starts at 2 a.m. in the morning or whatever it is. Yeah. And I think that's all I have to say. With that, I'm going to hand it over to Paula.
Thank you so much. Hello, everyone. My name is Paula Hechinger. I'm a psychoanalyst. I'm Brazilian. I lived in the United States for about 25 years. And I guess before we begin, I didn't have a lot of opportunity to be here in this group because I have been working a lot. But I would love to get to know each of one. If you wanted to just say your name and where you're from. And just say a little bit about just 1 minute about your story and how you got a VS. I think it would be very interesting to me to know. Let's start. If you want to start, just raise your hand. Okay.
And by the way, to raise your hand, we can do it that way, but there is a raise your hand feature at the bottom next to where it says recording. There's a little hand, and if you press that little hand, it comes up, and then Paula can call out, and hopefully we can hear everybody. If we cannot hear you,
okay,
then you need to check the settings at the top right and make sure you have the correct microphone.
Okay.
And there's also a telephone number that you can call to get assistance.
Mm-hmm. All right. I guess Cynthia.
Hi, my name is Cynthia Bachman, and my home is in Santa Fe, New Mexico, but I have a cottage in Nova Scotia, Canada, and I've been here since June, hanging on as long as I can, being out of the United States, because it's so crazy there. And I developed visual snow syndrome at the age of 67. It came on very suddenly. My beloved husband had been very sick with normal pressure hydrocephalus and Alzheimer's, and I was caring for him. And it was very stressful, and I was very sleep deprived. It started just very suddenly the night before we were going to be driving to Phoenix for brain surgery for him. And my initial symptoms were also included like a broken glass pattern and missing color. And it took me a long time to get a diagnosis. I finally got a diagnosis in Denver with Dr. Victoria Pellick at the Sue Ann Schutz Rogers Eye Center in Denver. And over the past few years, my my symptoms have actually really improved a lot. And I'm very happy about that.
Thank you. Thanks so much for sharing. Anybody else would like to share and tell your name and where you're from? All right, Frank, go on.
I'm
Hi,
Frank. I live
can you
in the
share?
Netherlands. I just got VSS this year, unfortunately. It started off in April, seeing floaters all of a sudden. We had a 9-month photo shoot near the beach. I was driving there and nothing was wrong. And I got out of the car and was on the beach, and all of a sudden they were all floaters. All eye doctors mentioned that I was crazy. It was between my ears. And I got diagnosed with VSS because the snow came somewhere in August. I have severe insomnia ever since. And it's getting worse every 2 weeks or something. So I'm really curious to learn if there are more people whose symptoms are getting worse. I have trouble working because I can't focus on the screen for too long. I need to wear special glasses.
Yeah.
And that's my story. Yeah, I'm 41. That's it.
Thank you so much for sharing. Thank you. Anybody else? Let's see here.
Yes, hello. Can you
Hi.
hear me?
Yes, I can hear
Hi
you.
there. Hey, well, this is my first time here, and I'm from Bolivia. I was
Welcome.
diagnosed with, yes, this is a country from South America here. I don't know if you know this country, but we live in South America, and I was diagnosed with this disease 2 months ago.
Okay.
And I'm 29 years old right now. And this is for me, it's very disturbing. It's very conflicted with my mind. And I found this foundation, this group, all these things on the internet because I couldn't find it between the doctors.
Yeah.
As you know, I think you have the same diagnosis that I have.
Yeah.
Like is doctors can diagnose you. That was my problem, and it's my problem right now. And I'm really happy for finding you guys.
Thank you. Thank you for sharing. Thank you so much. Anybody else? Go ahead.
Sanj has her hand up.
Sanj. Okay, I was trying to find the name. Yes. Go ahead.
You can see who has their hand up in the top right. There's a little
Okay.
hand
Right
there's
there.
two there, and I'm going to take Sanj out because our friend Sanj is next. Go ahead, Sanj.
Hi, I apologize for not being online when you first started. I missed hearing about everybody's stories. I couldn't remember the password to this computer. So it was a big Easter egg hunt to go find it. But here I am. So yeah, I have VSS, and mine is in connection with having Chiari malformation and Ehlers-Danlos syndrome. So it's a neurological thing for me, and it's been lifelong. I also have hemiplegic migraines. So that combination and a tethered spinal cord. I'm just made wrong. But I'm really grateful to find other people who start from understanding it, because like many of you, I heard from doctors all through the years, yeah, there's no such thing. Oh, just, my mom would say squint. my mom would say, don't make trouble. But when you can't see the world, you make assumptions about what's out there. Like I didn't know people could read street signs or house numbers. I had no way of knowing how much detail is available to people visually because it wasn't available to me. So a lot of the doubts that I had about myself are now more understandable. I'm at the end of my life after 7 decades. I'm at the point where I'm going, well, you know what? You did a damn good job of this.
For sure.
I kind of want a do-over. Give me the plot synopsis from the start.
Yeah.
Anyway, I'm here to listen to all of you. I want to learn from all of you. So
Well, thank you so much. Thank you for sharing. Next, I think is Cindy. Let me see, Cindy
Yes,
Miller.
I'm here.
Hello.
Hello. Thanks for coming online today. I appreciate it.
Oh, my pleasure. My pleasure.
I live in Loveland, Colorado. I've had VSS all my life. I've been aware of it. It was called skytopic sensitivity back in the day. And I was so happy to see the official name of visual snow syndrome. I did get diagnosed 4 years ago by Dr. Pellick in Denver, which was exciting to have that exact diagnosis that docs can look at. I didn't get much of treatment from that appointment. I do things on my own. I wear Erlen spectral filters that help keep migraines at bay. I don't have any more headaches anymore. It helps calm my brain. I also do neural feedback, which has helped. I did get COVID 4 years ago, which attacked my BSS severely. I'm recovering from that, from neural feedback. I do exercise. So, I found a way to cope with it. But I'm really looking forward to hearing some other, experiences and things that can be done.
Thank you so much. Thank you for sharing. Okay, the next one. Let's see if I can pronounce that right. Willemie? No? Did I get that right?
Hi, my name is Willemijn. I'm from the Netherlands. I don't know how exactly I got VSS because a lot of things were happening. I was pregnant when the full VSS started. I have every symptom in the book and it became like poof, like in a couple of days. But a year before, I got severe tinnitus. So maybe there were already some signs there. And I also have tingling in my feet and hands and some kind of nerve problems and erythromelalgia, or I don't know how to pronounce it in English, but it's something that the founder of PSI also has, Sierra. And so I had no health problems before or eye brain problems, but for me it started like boom. And since then I do have a lot of health issues. But now with my second pregnancy, nothing, it didn't become worse. It always stayed the same, but it's a big problem for me. I work in a medical center and with the lights and everything, and I go to patients and I'm not really happy about VSS. It really has. It took a big toll on my life plans and dreams and stuff. And it's been difficult for me. I have it for 3 years now, I guess. And
Thank you. Thank you so much for sharing.
Thank you.
Does anyone want to share? If not, I will start it. Okay. Anybody else? See your hands.
Just one quick thing, especially for those people who haven't been in the group before. We have a chat window, which is in the top right next to the little person with 16. There is two little boxes. If you click on that, there's a couple of messages in there, and you can use that. You can send a message to somebody directly, or you can send it to everybody, or you can just send it to the organizers. We encourage you to use that to put resources to share in there. And also we encourage you to exchange contact information with others in the group if you would like to. So if Frank wants to reach out to Wilhelmina, then you can forget. Who knows? Maybe you live in the same area. I don't know, but you guys can figure that out. But
We
we're
have each other's
very.
phone number already.
Oh, you do? Okay. Well, okay. Well, we're very, very, very proud that 46% of people that join AnCan across the board. This isn't just VSS. This is all cancers and VSS. 46% reach out to other people and make friends. And we extend our family. So I'm handing back to Paula, but I just wanted you to know that and connect with each other.
Thank you so much, Rick. Thank you. So I'm reading here. I'm Rachel, and I have VSCs. I can remember has got worse over the years after viral infection. Thank you so much for sharing your story. Well, I'm going to start again. My name is Paula Hechinger. I'm a psychoanalyst, and I have VS for the past 10 years, more or less, almost 11 years now. And of course, it has been a very difficult road for me. And I just wanted to say to start that I see you, I feel you, and I understand what you're going through. Most people that they come to me because I have Vision's No syndrome, right? Because you can relate it and you can connect it to me, because I can understand exactly how you feel all the time. So I have pretty much every single symptom on the book for Vision's No syndrome, okay? And I got a Vision's No syndrome while I was pregnant with my second child, right? And but I had like a few symptoms before, now I can like just put like one and one together and say, oh, okay, I get it now. But I have tightness before, and I haven't been suffering from migraines with aura since the age 12, right? But when I got pregnant with my second child, once it was like almost summer, I was just my garage doing like summer things. It was like actually I'm from Atlanta, Georgia, United States. I have a house there. It's a beautiful state. I love United States. And I was just sitting there while my husband at that time was doing some work, and I was started looking at the wall, and it was started seeing all these statics, right? And I freaked out because I was pregnant, so I thought something was wrong with my baby. And of course, I got so nervous and I started panicking, and my blood pressure went up and it was so high, and I had to be rushed to the hospital that day. And of course, the doctor is doing like, the test at that time, because I was pregnant, I could not do a lot of tests. It was very limited what they could do for me at that time while pregnant. And it was like, oh, you're just getting, very anxious about the pregnancy. You're fine. I went back home, and after few days, I started having like more symptoms, the statics, and every single symptom, it started like every few days after that, every single symptom started like just piling up on me. Like it was like literally unbelievable. And I was panicking because I was still 6 months pregnant at that time. But before that, actually, my story, I have been, I came from a family in which there was a lot of abuse, from my mother. I have a narcissist mother, which she has, she's an alcoholic. My father was as well. I had cancer twice, actually. I had like a thyroid cancer and ovary and uterus cancer. My thyroid cancer came in 2006, and my uterus cancer and ovary cancer came in actually in 2020. I had COVID, actually. I was in a hospital for quite a while. And what the doctors explained to me, which I still cannot understand, but I don't think they understand themselves. The virus from the COVID went to my heart, so now I take medications for tachycardia, which I have to take for the rest of my life. They don't understand why I have it, but I start having the tachycardia after COVID, right? So my life has been literally a roller coaster a little bit, and then VS just hit me, right? Before I became a psychoanalyst, actually, I work as a chef. I was a trained chef. I work in restaurants for about 13 years. And but when VS came, I was like, I couldn't like actually function, right? I could not function well to be in the kitchen and cut stuff, right? I was dizzy all the time. My hands were shaking. Would I have what I call this inner tremors that I feel all the time? Some people with Vision's nose syndrome have, some people don't, but I do. So it was very hard for me to work in the kitchen, right? So I stopped working, I stay at home with my kids. I do have two beautiful babies. One is 8 years old and one is 14 years old. Both of my kids, they have autism. And yeah, which it's a lot. They are very smart, very kind, very compassionate kids. But it comes with a lot of challenges that we have to face together, right? So my whole life, it was like, you know, a lot of stress, you know, a lot of anxiety, a lot of panic, a lot of depression over the years. One thing that I can say about myself, because, you know, we all have different stories. We all different. We all got VS. Some, you know, don't even know. Some people think that, oh, I got VS because I took this medication. Oh, I got a VS while I was pregnant, just like me. Oh, I got a VS because, some people that I have as my patients, they think they got VS because, the use of, drugs, even like weed and things like that. I'm so sorry. Oh, where are you guys? I'm so sorry. I just got a call from a patient. I apologize. But, true to be told, we don't know. We just don't have the right answer. Some people think, they're born with Vision's nose syndrome. One thing that I did, I could not drive for 5 years, actually, because I couldn't see right. I was very afraid. Fear literally just stopped my life in the beginning. My first 5 years with Vision's nose syndrome was like just literally hell. It was very hard for me. I couldn't see, I couldn't function. I was very isolated inside the house. I couldn't even go to the supermarket because all everything was like a lot of information for my brain. If I go to the supermarket, I had, panic attacks and so much anxiety. I could not drive because my after images were like so strong. And I stopped driving altogether. My life, I live with fear. I live with a lot of depression. And after a while, I decided to do something else. I say, I cannot live like this. I need to change my life. I need to do something. I need to find a purpose, right? So even with Vision's nose syndrome, I went back to school and I got my degree in psychoanalysis and in neuroscience. So everything that I learned about the brain, about the body and the nervous system, I start creating a system actually for myself. I was like, I need to understand what's going on with my body. Why am I going through this, right? And I needed to fix this. Of course, there's no cure, but I got better, right? Because I started to understand every day that the more anxiety I had, the more panic attacks I had, the more stress I had every day, I could tell that my Vision's nose syndrome got worse. And then I started questioning myself. I was like, I'm treating all these patients with depression, with anxiety, bipolar disorder, borderline disorder, schizophrenia. It was like, why can't I do something for myself? Why? So I started doing some research every day and say, okay, I know all this about the brain, the nerve system, about anxiety, about depression. How can I use that to benefit myself? And I start creating a therapy for myself. I start feeling my own body, right? And so every time that I had panic attacks, every time that I had anxiety, and then I just stopped and I say, okay, your vision is no syndrome is getting worse now. What's happening to your body right now? Talk to yourself, understand yourself right now, right? And then I would just start standing there and say, okay, I'm having anxiety and my vision is getting worse. And which symptom is getting worse right now with each panic attack, which anxiety, fear, and emotions, and things like that. So I started building a therapy for myself. And then after that, I started using on my patients. I'm going to try to share. I'm very new to this platform, so excuse me if I make a mistake. Okay. I'm going to try to share my screen. Let's see if I can do
this. Is it not working for
it.
you?
It's not working. No. Hold on.
Okay, so
So
press on share.
Yeah, I did.
And then share screen. You should see share screen when you press on share.
Yeah, because I did give permission to share. Oh, no, that's not what I want to share. Can you guys see my screen or not?
No, we cannot. So wait a minute. Let me just make sure that I have you as we should have you as a presenter. Well, I think for some reason I had you up as a presenter before, but wait a minute. I don't know why, but it doesn't seem to want to make you a presenter.
Yeah.
Yeah, it shows you as a presenter.
Yeah.
Go ahead.
Shouldn't have to. If she's an organizer, Rick, she can automatically present. She doesn't have to be a presenter and an organizer.
Okay.
She's actually got the presentation icon next to her name, but we don't see her screen.
Yeah, we don't.
Okay, so I can share my screen. So I made some notes to help you guys. So since I can, because I had this whole presentation, but it seems I can share with you. So I'm just going to read. Of course, you all know with Vision Snow syndrome, I have a lot of brain fog. So I had to make like a lot of notes. So I'm just going to go ahead and acknowledge Jan. That she's from Oregon, United States. I can remember for the tightness. Okay. And HHDs and autism. I got, okay, I see you. Okay, it's fine. Sorry for saying it twice. Okay, so what I do, so I want to explain my work a little bit. So once I start to understand that Vision Snow syndrome is not just a neurological disease, but emotional as well. And sometimes we don't understand that. Okay, so I start to understand how much my emotions affect my Vision Snow syndrome. Is Vision Snow syndrome doesn't have a cure just yet. And although we can go to Reddit, that's very much used by, people with Vision Snow syndrome and other platforms. And then you can be there talking about different medications. And then Vision Snow Initiative is doing a lot of research to find us a cure, but there's none that we know. I have been working with Dr. Michael in Illinois, and he's helping me by referring a lot of patients that go to him that they are diagnosed with Vision Snow syndrome, because he understands as well that it's not, okay, it's a neurological disease, but if you do not take care of your emotions and, and your panic attacks and your anxiety and your fears, your Vision Snow syndrome is going to get worse. Okay, so one thing that I start working with my patients, which I have quite a few right now, and I work on myself, is mindfulness-based therapy. Okay, so one thing that we do, we start to trying to not focus on, hyper focus on your symptoms. Once you're so focused on your symptoms are going to get worse. Okay, so what I'm trying to do in therapy with my patients first of all, one thing that I use, okay, I have a lot of things that I can use, but is a talking therapy, okay? Therapy means literally cure by talking, okay? When you talk, you start healing your nervous system because, you know, our brains with Vision Snow syndrome is just so overwhelmed, and we need to understand that. It's working 24/7, you know, like twice much as a normal brain, okay? Just to trying to figure out what's going on with this, why I'm seeing this way, right? So our nervous system is so hyperventilated. Our nervous system is so attacked by this disease every day, 24/7. Because if your eyes are open, you see. If your eyes are closed, you see Vision Snow syndrome, right? So we need to learn how to calm down our nervous system. And the first thing that I say to my patients, which is very difficult for people to understand, because we start looking for medication and we start looking for eye therapy, which I have done, and some glasses to help us actually see better our computers, you know, especially people that work with computers all day long, as I do. And of course, you know, there are options there to help us with Vision Snow syndrome. But one thing that nobody thinks about is the emotional side. The emotional side of the Vision Snow syndrome makes you worse every day because you cannot control your fear. You cannot control your panic attacks and your anxiety, which is linked to your nervous system. So one thing that I tell my patients is this: you need to accept. You need to accept that you have a Vision Snow syndrome.
Can I just interrupt? Would you like to send your slides to me or Bill, and then we can exhibit them, and you can just tell us when to move? Would
Okay.
that work? So
That would.
okay, so I'm gonna put I'll just put it in. I think you have it, but if you put it into AnCan.org and B Franklin at AnCan, if you send it to both of us, and Bill's probably better at it than I am, and we'll get them up. But if you send your slides to him, then people can follow you along on
Okay.
those.
You know, I just sent to you to the email that you talked to me today. Okay.
Okay, you just sent them to me?
Yeah.
Okay, all right.
Yeah.
I will open them, and then you'll see them when we open them. Sorry to interrupt you guys. I
No,
just thought
you're fine. So the first thing that I tell my patients is, you know, to accept, because, you know, you cannot live your life, especially for so many years, with a disease that doesn't have a cure, like fighting this inside of you. Okay, you need to accept. Vision Snow syndrome is a disease that is there. It's not going anywhere until somebody finds a cure. So you need to talk to yourself and say, how I'm going to live with this. It's not like cancer, right? That, you know, like the thyroid cancer, that you can just go to the doctor, say, let's do a surgery, just remove this out of my body. Is it in your body? Is in your brain? Is with you? Okay, you can work with, or you can let Vision Snow syndrome actually defeat you and define who you are in life. Most of my patients, they are depressed. They're inside the house all the time. They don't work anymore. They don't go out. They don't socialize. They don't make connections. They're just so isolated all the time. And I understand, because I was that way for 5 years. But, you know, you can fight. If you don't accept it, you're just making things harder for yourself. So you just accept, it's part of me. It lives in me. What am I going to do with? Right? Yes, Frank?
How do you cope with your brain becoming over aroused while working?
While working, well, you know, that's another thing that I do in therapy. We need to learn actually how to cope with our symptoms all the time, right? So every symptoms that you have. So actually, I have here some techniques that you can work on yourself to learn how to cope. It depends. Okay, if it's statics, for example. Okay, if it's just like, okay, I can work on the computer. For example, I tried the glasses that you have been wearing. Okay, it doesn't work for everybody. We are all different, and we need to understand that. Some things that will work for you, you not work for me. I try to wear glasses. I tried the green one, the yellow one, you know, the pink one. It did not work for me. Actually, it made my vision nose syndrome actually worse. There we have. I don't know if you guys can see it. Can you see that? I'm on the page of mindfulness-based therapy. If you go down. Mindfulness therapy. So Frank, so you learn how to cope by understanding how you feel, okay, and your symptoms. And by accepting too. You cannot cope with any symptoms. Okay, let's take vision nose syndrome out of the picture. Let's say that you have depression. Let's say you have bipolar disorder. Let's say you have borderline disorder. Let's say you have autism, right? So you need to have self-knowledge. Okay, you need to know yourself. You need to know your symptoms. Okay, despite what they are, you need to know your symptoms and you need to learn how to cope with them. Okay, I have the symptoms, and what can I do to make the difference? For example, I had like a lot of after image while driving, okay, and that's why I didn't drive for 5 years. So I started noticing, so you need to feel your body. And I know that sounds strange and doesn't make sense for a lot of people, but it helps. So I start to feel my body while driving. So it took me quite a while, because when I started driving again, I would go, actually, I got in my car and turned it on so many times and I just couldn't move. Okay, so I did that for like a few weeks. And then once I was able to move, I drove like 1 block, because, okay, what was happening to me? Fear was stopping me. Once you're so fearful, once you let fear actually take over your nerve system, that's what you need to understand. You take over your life. Fear causes anxiety. Anxiety causes panic attacks. And the panic attacks, you cause your symptoms to get worse. And that's what I understood little by little. So, and then I drove a block. And then the following 2 weeks, so I started, driving around the block. And then I went farther and farther and farther. And then once I started driving again, so I noticed that every time that I turn, the way I moved my eyes, the way I turned my head, made my vision nose syndrome actually worse, right? The after image. So I start training myself while driving how to look the right way, because most of us actually, you can say yes or no here in the chat if you want. Most of us with vision nose syndrome start having neck pain as well, right? So I have a lot of neck pain, a lot of nerve pain, so which I really believe is linked to vision nose syndrome. Okay, all my patients have that. I have about 15 patients right now with vision nose syndrome. So I started teaching myself. I was like, okay, Paula, so if you look this way, if you move this way, it gets worse. So how can you move? How can you look? And how are you going to do this to be able to cope with this symptom and be able to drive again? So I start training myself to look in a certain way and to move in a certain way. And this way, my after image will not be so bad and I could drive again. Today, I drive everywhere. Today, I go to different countries. I have been driving for many years again. And this is a victory to me. For some people it's so small, but to me it's a big victory, because, I could not get in my car and drive, but now I go to a different country driving, right? So you need to train your brain, with techniques that I'm going to teach you. So if you go there, the mindfulness, if you can read there, I'm sharing screen, the base therapy, right? So you need to stop focusing on your symptoms, because it's going to lead to anxiety, worseness of perception, and vision disturbance. That's proof scientifically. The more anxiety, the more you focus, the worse it's going to get. So you need to change that. So you need to observe without reacting to see the static, without adding emotional layers to your fear and panic. So basically what I'm saying there, your fear is making everything worse. So you need to ask yourself, what are you fearful? Why are you so afraid? Why are you scared? I was scared. I was scared that I was going to die, the vision snow syndrome, because 10 years, 11 years ago, nobody knew anything about it. That I was going to die. I was scared that I was going blind, actually. I was scared all the time to go out and have panic attacks and pass out because I don't know, if you guys have panic attacks or not, but they're pretty intense to me. So we live in constantly fear, and that's what we need to change. We need to change the fear. Okay, we're not going to go blind. We're not going to die. And we can control our anxiety, and we can control our panic attacks. And once you do learn all these techniques to control all that, the fear, the panic, the anxiety, what's going to happen? The vision snow syndrome is there, but it's going to be in the background. It's not going to be up front taking over your life. And that's what I did. Today, all my symptoms is literally for me in the background. And of course, don't get me wrong. Sometimes I have flare-ups because I'm too stressed. There's too much to do. I'm overworked. If I get a cold, my symptoms, I don't know if that happens to you guys, but most of my patients, they do that. If you get a cold, if you get sick, you have flare-ups, and then the symptoms get much, much, much worse because, it's all linked to your nerve system. Okay. I'm reading here, Paula, so much. Morphological instability. Have you had MRI? Yes. Yes. Most of symptoms of VS is very similar to different disease. For example, MS. Most of the people that have vision snow syndrome, they think they have VS, chiral malformation, cranial cervical instability. Yeah, I was tested for all that. I have so many MRIs. I had the spine tap, so much blood work, you name it, all the tests that you can think of that has to do with the brain and the nerve system, I had done. Actually, I'm a little traumatized. As a psychoanalyst, I have this trauma from doctors in hospitals because, I was in the hospital for so long, doing so many tests. And then every single test came back negative for actually chiral malformation, cranial cervical stability, spine tap, it was clear, no tumors. My eyes, I did every single test they can think of in my eyes. My eyes are, for them, my eyes are good. they're perfect, my eyes. So yeah, it's really hard. Okay, any more questions? Did I answer your question, Sanj? Okay. So what I work on my patients as well, okay? Once you understand that you need to accept, okay, and not fight. And some people, it breaks my heart because, it is hard. Sometimes we just sit there, and I understand why you do that. And then we keep asking ourselves, why me? Why I have this? Why the universe or God picked me to have this, because it's so hard every day, especially, if you have to work with computers, you have babies at home, you have so much to do. And then sometimes we just sit there and say, why me? And then, I start changing this thing that keep us in a jail of sorrow and pain. And I start asking myself, why not me? And I know it's a little harsh to hear that. And that's where, my patients, they have the power to change and the willingness to change. Why not me? So many people out there with, MS, chiral malformation, cancer. I had cancer twice. Why not me? What makes me so special that, I could not have a vision snow syndrome, right? We all go through life with so many things, with so many pains and sorrows and traumas. And that's one thing that I work in therapy too. Because once I start working with my patients, we start going back in the past, which is very important. Because the truth to be told, we are all traumatized. We all have traumas. And some of your traumas could have put you where you are right now, because your body have been so stressed since childhood. At the age 14, I was raped, and I lost my virginity by rape. And I know that my body has been stressed and, working in such a speed to protect myself since childhood, when I was abused by my mother. So one of the things that I work with my patients, I go back in the past and ask, let's talk about your traumas. Let's talk about your childhood. Let's talk about your life. Let's talk about your pain. Because therapy actually means, Freud said, what you don't say makes you sick. When you don't talk, makes you sick. When your body's hurting, because your body's telling that it needs help. When you cry, your body's telling you that your soul needs help. Your emotion needs help, that you need to cry, that you need to talk, that something needs to be healed. And I truly believe that when you start to work on your emotions and your traumas, you start getting better. I have patients that I can ask to come here and tell their stories after therapy, that we went back to childhood. And once you heal every single trauma, they start getting better. They start to understand how to control emotions and anxiety and depression, right? And not focus so much on a disease, but on a healing process. And that's very important too, because, we have, so many suggestions why we have vision snow syndrome. From my work, I believe that the emotional side of our bodies has a lot to do with vision snow syndrome. Things that you didn't hear, the things that we went through, and we never talk about it. Anybody has any question at this point? Okay. So, and then we go to techniques like body scan. Okay, that's very important when you're going through. Yes, Cynthia?
I have a question. I relate to a lot of your story. I grew up in a very violent alcoholic family. And then I did, in my 30s, I embarked on psychoanalysis. I actually had 10 years of psychoanalysis. It really was tremendously helpful. And then, but I did feel like I kind of had a PTSD from a very violent and frightening childhood. And so when you said that about your own life story, I've always kind of wondered if when the visual snow syndrome kicked in for me, I had a very happy life. I had a wonderful marriage, a wonderful husband, very happy. And then my husband's very rapid and terrible, decline is when the visual snow kicked in. And I wondered if the kind of PTSD, always my life waiting for the other shoe to drop, sort of set me up for something like that. And so I just wondered your thoughts on that kind of a situation.
Yeah, definitely. I truly believe I have patients that they have a terrible life story, just like in mine and yours, because your body just keeps accumulating. Okay, because what you don't treat, your body just keep it on check on that. Okay, one more trauma, one more pain, and they just go on and on and on. It's just like a bomb ready to explode. So when one bad event happens in your life, okay, or something out of the ordinary happens, actually I have like few patients like this that say to me, Paula, my body was ready to explode because, I went through this and this and this and this. And then one thing that was like huge to me happened. And then in few hours, I had the vision snow syndrome. I truly believe the PTSD, which I have like about 5 patients with PTSD, a lot of traumas. They say the same thing. They say I have been accumulating all these feelings and emotions, and this event made it vision snow syndrome, to come into my life, and it was just about to happen anyway. I really believe it's totally connected. Anybody else has a question? I don't know if I could answer your question. Yeah.
Thank you.
The next one. Let me see here. I'm sorry. Go ahead.
Yeah, I was just wondering if you've ever heard or talked about autoimmune disorders with this, because both me and my dad, we have like multiple autoimmune immune conditions, and we both experienced these weird neurological things kicking in after, like, as you say, like dramatic things or stressful periods of our lives. So, do you know if there's like a link between that?
Yeah, from everything that I have heard and read, because I try to do a lot of research before I can offer any kind of therapy. Of course, I'm not a medical doctor. I cannot, suggest anything on the medical side, okay, just on a psychological, emotional side. But all the research that I have been doing, seeing autoimmune disease, yes, can bring it up. Actually, vision snow syndrome, because it's linked to your nervous system. So what you need to understand, that everything that has to do with your nervous system, can actually bring snow syndrome. Anybody else? No? Did I answer your question? Anybody else want to know a question? Okay, so we do a technique that we call, body scan, anchor to breathe. The body scan slowly shift awareness through your body, noticing sensation, tension, and numbness. Okay, so when you feel all these feelings, the numbness and tension, so you have techniques of breathing, okay, that we can help you return, especially people that have DPDR. Is something that I have DPDR. Most of patients with vision snow syndrome, they go through a lot DPDR, which is very debilitating, right? That's why most people can work and function well, relate to other people, stop socialize, because DPDR actually, take you out of your own body. You don't know who you are anymore. You actually lose yourself. So, so the anchor of breathing helps you to return to the present moment. We have techniques in which, when you panic and you have a lot of fear, you just say, okay, you just look up and then say, okay, I'm panicking right now. I'm in a lot of fear. I'm going through a lot of anxiety, and I can see my vision snow syndrome going actually so crazy right now. Okay, my symptoms just like flaring up. So there are techniques that you can do to yourself, like, okay, I'm going to stop here and I'm going to breathe, and I'm going to look, and I'm going to see the 5 things that I can see first, and I'm going to stop and start naming them. Okay, so I see a curtain, and then I see a bottle of water, and then I see a cup, and I see myself. And then you touch yourself, which do have like the tapping technique as well inside the psychoeducation. Okay, so you need to start bringing yourself back to where you are, to the present. Okay, I'm here. Okay, I can feel myself. I can breathe, and I'm okay. I'm gonna be okay. Because when you have a lot of DPDR and a lot of panic attacks, it's going to hurt your nervous system, and your VS is going to get worse. Okay, bring you back. Okay, I'm reading here. So that's what we use for DPDR. You need to come back. If you have somebody with you while you have episode with, like, going through a lot of DPDR, you need to actually have like a support system. Okay, I have a vision snow syndrome, I have DPDR. Okay, and then if you feel that you're going like over the board. It's just like, okay, I don't know where I am. I don't know what's going on with me. I can recognize myself. That person needs to know some signs to help you. And then actually one thing that I use, which I use with my patients with autism, is, and it helps a lot. And my patients with Vision's Nose Syndrome have been using for DPDR, which helps a lot. That person just comes and hugs you very tight or wrap you in a blanket because you need to feel safe. The problem with Vision's Nose Syndrome, we don't feel safe. We are always in fear. And we need to start feeling safe. We need to understand that it's okay to have this and be willing to understand the process of healing to overcome what you're going through and change your life. Okay, so we do like somatic therapy for the nervous system regulation. Okay, because you need to calm down. I don't know if you can read is still there. To calm down, overstimulate your nervous system and have patient regain a sense of safety in your body. Why Vision's Nose Syndrome sometimes gets so worse, why you have a flare up actually, because we don't feel safe. And you need to feel safe on your body. Okay, so we do the somatic therapy as well. Grounding, feel the floor, notice your sensation. Am I tingling? Am I thirsty? So drink some water, get some ice and put in your wrist. You need to bring your back to your safety, okay, and not drift because you keep drifting with the PDR, okay? Okay, so I'm seeing here about the compression surgery. And I have patients that they did have tiara malformation and they have like disc problems. And they did have like surgery and did not actually help. I have one patient that she's from Texas actually and did not help with Vision's Nose Syndrome. But if you have surgery for any of those things and if you helped, it's a good information to me, to everybody. Another thing is that the trauma-informed psychoanalysis. This is the most, the part that I love about my job, okay? That we're going to through trauma. Chronic symptoms like VS can become containers for unprocessed grief, guilt, rage, and rejection. So, and then we go back about accepting what you have. Because if you don't accept, you just keep grieving and grieving and grieving. And one thing that I tell my patients, because my patients, they're telling me, I wanted to have the life that I had before. You're not going to have it. Not right now. Okay? And I know sounds actually harsh to say that. But the truth to be told, once you accept that you're not going to be the same person that you were before, you can't go back to the person that you used to be. Okay? And we need to accept that because you keep fighting against this feeling of, okay, I wanted to be able to do this and this and this. I wanted to feel the same way that I felt before. You're not going to get that. And I know it sounds very sad and it breaks our hearts, but you can't. It's not going to happen. You need to accept the person that you are right now with Vision's Nose Syndrome. And then you need to look at yourself and say, what am I going to do with this new person? You need to look at yourself and say, okay, like I did, that Paula without Vision's Nose Syndrome, she's not here anymore. Okay, she died and I needed to grieve her. And I needed to accept this new person that I am right now. And I know it's hard. This new person with Vision's Nose Syndrome, that's who I am right now. Okay, Vision's Nose Syndrome doesn't define who I am. It doesn't get hold of my life and do whatever it wants to do. You need to have the willingness to say, this is the new me, and I'm going to grieve that one. I have a guy that he's in Germany, actually has been in therapy with me for about a year now. And he used to cry a lot and say to me, but Paula, before Visions No Syndrome, I used to go to the gym and I used to run like, 5K, 10K, and I can't do that anymore. No, you can't. But yeah, because that person that you used to be is not here anymore. But what can you do with the new person that you are right now with Visions No Syndrome? And he's like, I don't know. I think I can't do anything. I was like, so let's try. And then that's when we started doing exposure therapy. That's a very important part of the therapy. Okay. Why? Because everything that you fear doing, they used to do before, we're going to put you through. But, in a very small doses. Okay. Not all the time. And I told him, okay, you used to run 10K, 5K. So let's see, how much you can run right now. And then he started with 1, and then 2, and then 3, and then 4, and it's like the maximum they can do at 4. It was like, and that's great, because that's your new you can do 5, you can do 10, but you can do 4. But one thing that you can do is staying in your bed, laying there feeling sorry for yourself. You need to fight this because you have a life to live. You can just sit there and exist because you have people that love you, because you have to love yourself enough to look at yourself and say, I'm going to live this life despite of Visions No Syndrome. And that's what I did. Going to Uganda, being a volunteer in Uganda, it was very hard for me, but it's something that I really wanted to do. You need to find your new you to live with Visions No Syndrome. And all that we learn in therapy. Of course, I do like CBT informed modified therapy for Visions No Syndrome, because the normal CBT therapy doesn't work very well. We need to modify that. We do like breathing work for you to regulate your nervous system. And then we start working accepting and getting a purpose, because most of people with Visions No Syndrome, they lose purpose in life. What am I here for? What am I going to do? If I can't be the person that I used to be, so what am I going to do with this new person? Like me, I used to be a chef. I went to school. I went to culinary school for 4 years. I worked as a chef for 13 years, and I loved that. I love to be a chef. I love to cook. It made me happy. But then Visions No Syndrome changed my life. So I had to find a new purpose in life. And I became a psychoanalyst. And I love what I do. I love what I do. But I had to let go of a passion that I had before. And I had to find a new purpose. So my question for you guys actually is, have you found a purpose with Visions No Syndrome? Anybody want to say anything at this point or have any other question? So I'm reading here, Rachel, I find my migraine makes my visions no worse. I'm trying to get my migraines under control, but I didn't know I had migraine for the longest time because I don't have traditional head pain. Everything you say feels like something I have really need to hear for a long time. Thank you. You're very welcome. Yeah, I suffer from migraines as well. And sometimes, a migraine with aura comes without pain. Pain comes after, and we think it's a headache. And it's proved scientifically that migraine is going to make your Visions No Syndrome worse. And then, of course, when you go through therapy, and then we learn how to process all the emotion, all the traumas that we have, all the fears, all the anxiety and everything else. And even your migraine, you start getting better, because migraine is a process that body goes through with stress. The less stress you have, the less you're going to see the symptoms. So why you do therapy, Paula, if you can cure me? I do therapy to make your life better. Like my life is better. Today, I know how to control my symptoms. Today, I know how to control my emotions. Today, I know how to control my panic attacks. Today, I know how to control my anxiety. And today, I know how to control my life. I have control of my life. You know, if you're afraid, you do afraid anyway, you know. But the process of therapy, the things that we do as well, drawing, painting, journaling, you need to let it out, all your anger. I know you're angry. I was angry for a long time. I didn't want to accept. I was angry. I was angry at myself. I was angry at God. I was angry at the universe. I was angry at my husband and my kids and my parents. And I was just angry, you know, and you need to let it go. You need to let go the anger. You need to be healed emotionally. And this way, your VS is going to be in the background. All my patients today that I have been working with me with traumas and with all the emotions, they look at me and they say, you know, my vision is no syndrome is fine on the background. I'm up front. I'm driving. I take the wheel. Anybody have the question?
So Paula, we should try to wrap up the end of your presentation in the next 5 minutes or so, and then we'll stop the recording. And then I'd like to suggest that what we do is have a discussion, because there's a lot of things I think people may want to talk about, and they may not want them on the recording. So we will stop this and then go into the support group session, if that's okay.
Yeah, that's okay. That's totally fine. So basically, I know I talk a lot, and it's a lot to, you know, to try to understand about the therapy that I do. But basically, I have been reading here, people saying, you know, things about emotions and migraines and things like that. But pretty much, you know, this therapy is not here to cure you. It's to help you be your new person with vision no syndrome, give you a purpose in life, you know, try to make you understand that you need to accept what you have, grieve the person that you used to be, and find a new purpose in your life like I did. Today, I'm living a full life. And yes, I do have flare-ups that, you know, sometimes, you know, I need to rest. Sometimes I'm not feeling well. I need to take a few hours just to rest. And then there's that saying that when you're tired, just rest. Don't give up. So, you know, for me, to you, from my heart, just when you're tired of living with vision no syndrome, just try to heal yourself, heal your emotions, your nerve system, and rest. But don't give up on yourself, because, you know, you have a purpose here. And I say, I did a podcast a while back, and I say, if, you know, the purpose of my life now, you know, it was to have a VS, to help, you know, other people, so be it. And I know you have a purpose too, living with vision no syndrome. You just need to find your place, and I know you will. And then take care of your heart, your emotions, and you see, if you give a chance to therapy to take care of your traumas, emotions, anxiety, panic, and fears, you see how much better you're gonna get. Thank you so much, from the bottom of my heart, for listening to me. I'm very humble to be able to be here and be part of this beautiful project. Thank you so much. Thank you, Rick.
Thank you. And we will include the PDF with the recording. We should get the recording posted within a few days. We will probably send it out. I think we'll send it out to everybody on the list who's getting a reminder. If you're not getting a reminder, you can put your email in the chat to me, to everybody, or to me directly. We'll make sure you get signed up. I'm going to stop the recording right now. So thank you, just for the record. Thank you so much, Paula. It was,
thank you.
I mean, I had some insights during this that are mind-boggling, and maybe I'll talk about that during the next session. And please, everybody, stay on, because we're now going to go to a discussion, a support group session, and we'll make sure everybody gets time who needs time in the support group.
Thank you